Dasman Diabetes Institute opened a two-day conference at its headquarters, bringing together international health specialists to discuss, educate and raise awareness on the various problems of diabetes, specifically renal and vascular complications. Sarah Faris-Glob was there with this report.
Dasman Diabetes Institute launched a conference entitled A Multidisciplinary Team Approach to Vascular and Renal Complications of Diabetes in cooperation with Harvard Medical Faculty physicians at BIDMC and the University of Malaya in Malaysia.
It has been a mission in Dasman to try to anticipate and prevent complications of diabetes. I have been taking care of patients with advanced diabetes now since 1977. And over the years, I saw many patients with peripheral vascular disease, cardiac disease, renal disease. They fail. They have a miserable life expectancy, a miserable lifestyle. This conference essentially is to start bringing awareness and heightening the awareness, because in the Middle East we have too many cases where they do amputation on legs that could be salvaged. In our hospital, the rate of amputations on non-healing ulcer is less than 1%, but here and elsewhere could be as high as 60%. And when you salvage a limb and the person keeps walking, they can become productive members, keep supporting their family. The impact is huge. So we hope at the end we can start the interest mushrooming into prevention of leg ulcers and leg amputation.
Diabetes is a serious and prevalent disease, especially here in Kuwait. High blood sugar level can cause problems in many parts of your body, especially the kidneys, heart, blood vessels, nerves, and urinary tract.
I'll be talking about how to screen patients for peripheral arterial disease, and then how to manage them, in particular how to decide who needs to be revascularized, and then how to choose between bypass surgery and interventional methods of angioplasty and stenting. With appropriate identification of patients and treatment at the appropriate stage, we can prevent limb loss.
Specifically, I'll be talking about doing foot surgery on patients with diabetes for the healing of chronic ulcerations, non-healing wounds. Diabetes is a very worldwide disease. The incidence and prevalence of diabetes is increasing. The cost of care, of taking care of these patients, is increasing, and the rate of amputation is increasing. And that creates a significant economic burden on everyone. And Dasman has taken the lead in developing a multidisciplinary team approach to help tackle that problem here in Kuwait.
Foot complications are the most frequent reasons for diabetes-linked hospitalizations and amputations, but many could be prevented by better management of diabetes disease. In order to reduce the rate of surgery and amputation for people who suffer from diabetes, Dasman Diabetes Institute has organized this conference to gather international and local healthcare professionals to collaborate and educate in raising awareness on some of the alternative practices, with the most important aim in mind that with diabetes, prevention is always better than cure. From Dasman Diabetes Institute, this is Sarah Glob reporting for English News.